Ladies and gentlemen, welcome back to On the Mic with Mike. It is the premier business radio program around. Well, it's business ish. We talk to the game changers out there, folks who are making a difference in our global village, the people who are out there making a difference in lives of others. So, this is part of the Mike King Biz Radio Network, which is ESPN Richmond 106.1 from 5 to 7 every day, well, Monday to Friday. And then, as well as The Choice, which is 105.3 from 2 to 3 p.m. We're out there telling the stories about what's happening. We were out there to uplift the community and showcase RVA in a different way. Today, in this business, this is called a get. When you see someone out there who is doing big things, and he comes to us, by the way, our good friend Lauren Moore. Shout out to Lauren with the Children's Hospital Foundation. She tells me I have to talk to the CEO of the Children's Hospital. I'm just a humble public servant. What am I doing now? I'm talking to welcome Elias Newjar from the Children's Hospital of Richmond. How are you, sir?
Mike, it's great to be with you. Thank you for the chance to spend some time and talk about some great things that are happening here. And I'm very grateful to Lauren Moore. I'm a huge fan of her and the foundation. They're great partners.
Alrighty, sir. We're going to start this. We start off with this is the infomercial for the Children's Hospital of Richmond. You are the president. You are chief cheerleader, the visionary behind it. Give us the elevator pitch about what's happening and who you guys are.
You betcha. So I'll tell you, first things first, being a part of a children's hospital is special. You know, you're surrounded by dedicated clinicians, outstanding team members, a community really all focused on caring for kids and families. And one of the things that I love about being a part of the children's hospital team here is that we are completely committed to excellence in care for our kids and our families, and a concept called family-centered care, which means not only are we treating and healing the child, Mike, but we're also focused on the family. And that's really special. And so having the chance to be a part of the Children's Hospital of Richmond at VCU at this time is pivotal because we've got several exciting things that are happening. We're building a new world-class children's hospital, inpatient hospital, that will open in the spring of 2023. And it is truly full service, comprehensive, state of the art. We'll talk about that in a few minutes, what that means. We also are recruiting and bringing in some of the finest talent around the country to be here in Richmond to care for these kids and families. So the goal is to make sure that they don't have to leave their community, their schools, their families, their roots, right, when they're in need of medical help and support and direction and a plan of care. And then also, too, being a part of an academic medical center, it's pivotal because you have a chance with our education and research agenda for innovation, which really does translate into healing and quality, and that's what we're about.
Mike Elias is here with us. He is the president of the Children's Hospital of Richmond. I'm from Philadelphia, and I think a lot of times if you'd be hard-pressed to ask someone what is the most well-known hospital in Philadelphia, they say it's Children's.
Yeah, it is. You know, CHOP, Children's Hospital of Philadelphia, is a fantastic children's hospital. There are roughly 250 children's hospitals in the United States.
Wow.
I've been in pediatric medicine 21 years, so it's in my blood, it's in my heart. Originally started at Colorado Children's many, many years ago. And I'll tell you, when I look at the level of expertise and talent, our quality, the work we're doing here, it is on par with the best in the country. And I don't say that lightly. And yet, what I think you find with our team members is this humility to heal and to serve and to help others. And think about this, in time of critical need, tragedy, uncertainty, stress, a need for a helping hand, a big heart, not to mention a great mind, and absolutely focused on resiliency. And it is an honor for us to be able to serve this community. I assure you, I feel that, as well as our 1,100 team members who are part of the Children's Hospital.
Word on the street is you guys are building something extraordinary. You guys are building it, and if they say if you build it, they will come. You don't take that as, you know, a grain of salt. You're going out there and getting the best and the brightest. You're building the best facility, and then you're going out across the world and recruiting. Talk about the two of those things right there.
You know, that is so important. And when I look at the new inpatient tower that's being built, our Wonder Tower, it truly is full service. So it will include our pediatric emergency department. It will include our level 1 trauma program, which we have a level 1 pediatric trauma program that's outstanding, that serves this entire region. It will include state-of-the-art operating rooms, state-of-the-art ancillaries, including diagnostic imaging. It will include state-of-the-art family-centered and beautiful rooms for our families. We'll have 72 rooms in the new tower day one. Those rooms are 330 square feet apiece. They all have private restrooms. They all have couches that fold into beds for our families who want to stay with their child. We'll have other amenities in the Children's Hospital, play spaces where kids can be kids. We'll have the ability for these families to be encompassed in total committed care for children, which is important. And then the connection to the medical center. We will have a bridge that will connect into the medical center where we have our neonatal intensive care unit. That is important. The adjacency to obstetrics, which is critical. And then as you think about healthcare for our young pediatric patients, as they grow and they become healthier young adults and adults, to have the ability to work with a medical center and all of our talented specialists is a big deal. So it's very, very special.
One of Mike, ESPN Richmond. We are with the president of the Children's Hospital of Richmond. Elias Newjar is with us. Sir, I talk to people all the time. I ask them how COVID impacted their business.
Yeah.
I'm talking to the guy who is smack dab in the middle of it right there. You guys have, and the medical field has been impacted big time. Talk a little bit about what that means. We were doing dances before because we thought we were done with it, but now I don't think that's happened.
Yeah, that's right, Mike. This is a really important time for our community, for our country. We're seeing this Delta variant, and I'll tell you, as a dear friend of mine from Children's Hospital of New Orleans, Mark Klein, said, this is not your grandfather's COVID. This is, for children, this variant is highly contagious, and we have seen that it has an impact on kids. There are a couple of things I would tell you. Number one, our teams are tremendously committed to supporting this community. We've seen activity here in this community well over the last year and a half, and we're starting to see those numbers come up. So I can tell you the variant is in this community. I also know that when we think about the needs of our teams, and they've been, battle tested, I worry and I think about their resiliency and the need for them, of course, to stay strong and support our kids and families. And they are incredibly devoted. But here's what it comes down to. It comes down to all of us in this community working together, arm in arm. Please wear masks. Please, if you can get vaccinated, get vaccinated. That's so incredibly important. And then I'll tell you, I'm very hopeful that this fall we'll see some positive movement with some of the clinical trials on vaccinations for kids between the ages of 5 and 11. I think that's a tremendous opportunity and one that we're all looking forward to. And I'm very hopeful that will be here sometime this early winter, late fall. And then, I think the other piece is we've got to give each other grace. There's a lot of stress that all of us have been dealing with. And I look at, the tragedies of deaths that have occurred. And this is all over the world. And it's been a silver lining of reflection to say what really matters. You count your blessings, the time that you can spend with loved ones, even if you have to do it virtually. And then when you get the chance to do it together, it's special. These are things, I took for granted, right, before all of this happened. But I tell you, we are strong and we are committed and we love serving this community. And I want this community to know that VCU Health and certainly the Children's Hospital of Richmond at VCU stands ready to continue to support our families who are impacted by COVID.
Elias Newjar is here with us from the Children's Hospital of Richmond on the mic with Mike. We're here daily from 5 to 7 a.m. Sir, you said around you're building the Wonder Tower. You guys had the big plans. Everything was going great. You're just feeling pretty good about yourself. Corona shows up. What does that do to building the building that you guys are building, the Wonder Tower, and how did it change the plans and what has it done?
Yeah, great question. I tell you, there are a couple of things that come to light. Number one, through the pandemic, it has really challenged us to think differently around how we serve our kids and families through this pandemic, this crisis. So we've seen a real focus at times shifting more toward the virtual world in caring for kids. When we we're doing virtual visits. Before the pandemic, we were maybe doing, 20 visits a day, right? And then to go through the pandemic and now translate to several hundred visits a day that are being done virtual to meet the needs of our families. I mean, it's a testament to the whole team, the commitment of the families to work with us through that experience, and then really to do it in a safe, high quality, committed way. With the building, we took hard look at our scope and our plan. And I'll tell you, the health system, and I'm indebted to President Michael Rao, Dr. Art Kellerman, our VCU Health System Board, our Children's Hospital Foundation, and our community. Mike, these folks all stepped up and said, this project's too important. Serving the needs of kids and families in this community is too important. And we actually made some important decisions to actually add some dollars to the project to help us actually do more good. And what we're actually seeing, Mike, is that we're serving more kids. We're actually seeing that our acuity is higher. We're actually serving sicker children as well. And yet we're so committed to our quality agenda. And I'm proud of the high quality work that our teams are doing in caring and healing for kids and families. And so what we've actually seen is an increase in volume. Our outpatient clinics are busier. Our surgeries are busier. Our inpatient admissions and our inpatient census is actually higher than pre-COVID. And the acuity of these kids is actually higher. And so, our challenge is to make sure that we sustain our teams. And I'll tell you, to have the blessing of building a state-of-the-art, comprehensive, full-service children's hospital is a huge recruitment tool for us to recruit the very best from around the country. It's also a great retention tool for our teams, right? When you come into an environment and you're in a holistic, fully dedicated, pediatric centric environment, it is a huge advantage, not only for our families, but also our care teams. And I'm really proud that this community is going to have this. I do not say this lightly, but I believe it is a crown jewel of the community. And certainly, as we're recruiting businesses and families here to come and serve in this community, I hope it gives them some peace of mind knowing that they've got a world-class children's hospital here with nationally ranked programs.
That is true. It's funny when you say everyone thinks about recruitment. You just dropped in there retention, because if you have the best and the brightest, other folks are looking at the best and brightest in there. So you're saying we're going to recruit the best, but we got to hold on to the great ones that we have here, because that creates an issue as well.
It really does. And there's a great principle that I try to think about all the time. You got to re-recruit your people every day. The vision, the inspiration, the support, the listening, the partnering, that's so important. And then I think the other piece too is when you have more success and you become more visible, some of these other places want to go recruit your people. And that's a great compliment. It's a great compliment. And, always you want the best for your folks, but you want them to be inspired that you've got a vision that's compelling and doing some incredible things that would warrant their career staying with us. And by the way, these pediatric specialists, these talented team members are in short supply with a lot of demand at all these children's hospitals around the country. So, it really demands that we're at our best. I need to be at our best, right, to make sure our folks feel connected and appreciated and supported.
Ken, from the business standpoint, when we talk to folks over on the tours inside Jack Berry and the team, to getting people to come here, we always ask, kind of, who do you compete against? And they'll go and name, a number of towns, whether it's Charlotte or, Memphis or Austin. Is it the same way in your world? Do you guys compete for whether it's talent or patients?
Yeah, it's a great question. There is definitely competition. If you think about it, this precious limited pool of talent, they can go anywhere. You want them to come here and be a part of our team. So, you've got to have a vision and a game plan and support and execution that inspires confidence for them to come here and be a part of this. For the patients and families, of course they have choice, and you always want to make sure that they feel wherever they go, they get the best level of care and expertise that they should get. And choice is a powerful thing. It keeps us on our toes and ensures that we're at our best. In the children's space, it's actually quite interesting. We actually think collaboration. And the great children's hospitals partner with one another, sharing of knowledge, protocols, expertise, even talent. And so I think what we've done here within CHOR is struck a great balance between that competitive piece of growing and thriving and having great success, but then also collaborating and working together. And there's some great examples, St. Mary's and Chippenham and Johnston Willis. We have great relationships with those folks where we partner together. Our specialists actually staff the pediatric intensive care unit at St. Mary's and their acute care pediatrics unit as well. What that's done for us is allowed us to keep kids close to home in that area, to be served with talent that's working arm in arm with our talent here at the Children's Hospital of Richmond at VCU. And it's positioned us so that children can be cared for, right team, right time, right setting, right? And so if there's a need to transfer to a higher level of care or a need for transfer for any other reason, we can work together and make sure that happens, hopefully seamlessly and smoothly. My biggest worry, my friend, is that a child and family fall through the cracks, right? They get lost in the gaps. And that's where I think being collaborative like this positions us to be at our very best as a community. And then with Chippenham and Johnston Willis, our team staffs their neonatal intensive care unit. We're proud of that relationship. We've seen great work in improving quality and partnering together. And these are relationships that our teams are proud of. And I think it speaks loudly to the community that we're putting kids first and making sure that we can work with these families in the right way. I also see other opportunities across the region, where we're working with UVA and their Children's Hospital. They've got a great leadership team. Children's Hospital, the King's Daughters, really respect Jim Dalling and their team. And we're constantly talking about ways that we can learn from one another and work together. Advocacy, research, education, certain clinical programs. There's opportunities for that. And then nationally, you see great involvement of the children's hospitals working together on a number of initiatives. I sit on the Children's Miracle Network National Board, and that's quite an honor to be able to be on that board and work with some of the best and brightest minds in the country. I'm not sure what they were thinking to allow me to be on that, but it's been a great honor and I think a great statement of support for Richmond.
One of the things, sir, when folks come on here, we ask them sort of to speak for their industry. I know it's a tough place. Explain to our listeners why we as a country need to help underdeveloped countries with the vaccine. Like, why is that?
Well, I think part of our service mentality, right, is to help those who need help.
Yes.
And I tell you, in addition to being so proud of being a part of the Children's Hospital world, and certainly the Children's Hospital of Richmond at VCU and VCU Health, being a part of the United States, what a special honor and privilege it is. I see this country as a leader, in the entire world, and you see us stepping up and helping others. And I think that is incredibly meaningful. The vaccine is a modern miracle. I mean, I think about the things that I've seen through the course of my, 46, 47 years on this earth, to be able to see the best and brightest come up with these vaccines and the impact it has, the life-saving impact it has, is nothing short of a miracle. And it makes you proud to be a part of it. And by the way, I say this with great respect. I know, it's not an easy topic. And certainly there are those who are concerned about it, unsure. Trying to get education out there is so important, making sure that people have the facts. But I tell you, if there's a message I would share, it's mask up. If you can get vaccinated, please get vaccinated. Please look out for one another. Show grace, show resiliency. Arm in arm, we're going to get through this, and our best days are ahead of us.
That's good. So Elias Newjar is with us, president of the Children's Hospital of Richmond. Sir, please explain to our listeners the relationship between you guys and VCU, because a lot of times people don't understand that.
Yeah, no, Mike, that's a great question. And I'll tell you, as passionate as I am about being a part of the Children's Hospital team here, I love being a part of VCU. I love being a part of the health system. VCU, I think about what the institution has meant to this community, the transformation, the education, the learning agenda. I mean, it extends into many classrooms, and then the impact on the community. Again, I got to give a shout out to President Michael Rao. Sets a high mark as president of the university. He's been a huge supporter of the Children's Hospital, of me. And then I think working with our health system leadership, Dr. Art Kellerman and his support, which is so pivotal. All of our leaders in the health system working with the hospitals that comprise VCU Health. we're proud to be the children's hospital of that health system. And then the work with our Children's Hospital Foundation, which is solely dedicated to our children's health platform and the work that's ahead of us, they're the accelerant of such good and impact for kids. And so you put it all together, it's a powerful recipe of good. And yet what's great about the Children's Hospital is we have this full service, dedicated, comprehensive team of experts that also aligns with our adult colleagues within the health system. And again, for those kids who become healthy young adults and adults, that transitions of care piece is solid and intact. And then for kids who have parents and grandparents and aunts and uncles and other relatives, we want to care for the whole family. That's something we take great pride in. And I think VCU Health and the university, it's a privilege for me to be able to be a part of it.
As a leader of a health facility and health organization, any different that you would think of leading a non-health organization, like the CEO, president of a hospital type facility? Are the concerns there the same as a person who's not in that world, or are president, CEO duties, thoughts, vision kind of the same? You just have one specific area that you need to touch on?
Yeah, no, I think that's a great question. I think there are similarities in the sense when you lead an organization, you want to be very intentional and focused. What are the right priorities? What is your mission? At the end of the day, what's your true north? It just so happens to be, for me in the children's space and our teams, it's focused on the health and well-being of children and families. And so that becomes our true north, a lightning force of good. It also requires great stewardship, right? So I feel very accountable to making sure we, the Children's Hospital, are making great decisions around financial investments, right? So it's not only the healing and impact of kids, but it's also sustainability, right? Because if I'm not making those good decisions and we're not using those dollars preciously and carefully, and I put it at risk, well, then you put the health and well-being, right, of risk in the community. And one thing that I have certainly seen and I appreciate here, and this is within the health system, the university, and certainly within CHOR, there is tremendous focus and commitment to good stewardship, as well as a strong, high-level commitment to quality, safety, and outstanding experience. You put those things together, I think it's a recipe for excellence. And that's really what we're pursuing relentlessly every day. I wake up in the morning and I just think about this. My mission code is to do good for kids and families, and our teams feel the same way.
Sir, that is a knocking it out the park statement right there. That is for sure. Let me say, okay, so we have one, for me, I have one good question per interview, and this is it. What gives you hope?
You know what? What gives me hope is our people. I see it in their eyes, whether it's our families, our kids, our team members. In all of us, there's good that wants to help another human being. And I think when we're tested, you see amazing things come out of that, right? It's not always fun. Adversity is a struggle, and yet it reveals character. And Mike, what I am so humbled to see is the character of our community and how people step up and support one another and, sacrifice and look out for one another. And so I think it's our people. And I'll tell you, I don't say this lightly. We're going to get through this, and our best days are ahead of us.
Ready, sir. So one of Mike Elias Newjar is with us, president of the Children's Hospital of Richmond. Sir, thank you for your time. You didn't realize it. Now you're part of the family. So whenever you guys have information that you need to get out there, this is the place we always have a platform open for you. Please give my regards to Lauren and your staff, who helped make this happen. Now, you're a busy man. So, you got the folks to get you here all dressed up for us as well. One of Mike with Mike, sir, stylish. That's the look of a leader setting the tone. Sir, we'd like to thank you for coming on the program. On the Mike with Mike, we bring you the best and the brightest. That's what we do. Elias Newjar, sir. Oh, really quickly, how can people find you guys out there? What am I doing?
Hey, no worries. You can find us on a variety of sites. So certainly on the web, you can find us. That website address is www.chrichmond.org. Look for us there. Certainly, we have several different locations, and privileged and honored and ready to serve this community when you need us. And then, of course, listen, sir, if there's ever anything I can do to help you, don't hesitate to reach out if there's a child or family that needs us. And my last comment is thank you to you for using your platform to get vital information out, education, listening, awareness, tackling some of these key issues. Somebody told me once the opposite of fear is education, and I can see you're out there pursuing it. So my hat's off to you.
Appreciate that. Don't tell anybody. I'm having a ball doing this.
Outstanding. Thank you.
Appreciate it. Thanks. Now take care. Bye-bye.
All right.